Follow all requirements of the OR table used. We recommend flipping the table orientation 180 degrees when possible, so the long portion of the table base will be situated under the patient's center of gravity. This usually provides maximum stability. Ensure there is adequate clearance for the C-arm to maneuver into place. Remove OR table head section. Lock the OR table in place. There are three main components in the system: the arch, opposite leg holder or OLH, and the perineal operative post or POP. The arch is freestanding, and the OLH and POP attached to the OR table side rails. The arch has two storage rails to hold the OLH and POP when not in use. Roll in the arch and position near the end of the OR table. The OLH holds the non-operative leg. It has two main components, the extension rail and the extension deck. It is easiest to handle the two components separately when moving the unit. These components are attached with the pin and sleeve as shown. To remove the OLH from the arch, push the button on the end of the pin and remove the sleeve. Loosen the lever, then remove the extension deck from the extension rail and set it aside. Remove the extension rail from the storage rail. Slide the extension rail onto the non-operative side OR table side rail. The POP attaches to the operative side OR table side rail and holds the patient in place during the operation. It has three main components: the post, the femoral support, and the adapter rail. The star grip knob holds these components together. Wing nuts are used to secure the POP to the OR table side rail. Remove the POP from the storage rail. Loosen the star grip knob and remove the adapter rail. Slide the adapter rail onto the operative side OR table side rail. The initial setup for left anterior hip case is now complete. Prep the OR table, then transfer the patient onto the table. Wrap the patient's leg with Coban from the foot to the upper shin. Ensure to wrap far enough up the leg so the traction boot will not directly contact the patient's skin. Repeat this process for the other leg. Ensure the Coban is evenly wrapped. Next, put boot liners on the patient's feet. These create a more secure traction boot fit and can reduce the risk of pressure points from the traction boots. Flip the boot liner inside out and roll it over and around the foot. This will help ensure the heel is fully seated in the liner. Roll the excess foam over itself and hold the liner in place. Another staff member can then wrap the boot liner in more Coban. This will secure the liner and keep the foot from slipping within the traction boot. Repeat this process for the other leg. Undo all straps on each traction boot. The operative boot has knurled nuts that attach to the arch. The non-operative boot has smaller fixing knobs. Slide the foot into the traction boot. Ensure the traction boot flaps are free and not folded under the foot. Flex the knee and push on the bottom of the boot to ensure the heel is fully seated. First, secure the strap over the ankle. This strap is the most important for holding the foot in place. To tighten the strap, pull down firmly, then lay the strap back over itself to secure the Velcro. There is no need to pull up firmly on the strap, as this could damage the boot. After the ankle strap is attached, fix all remaining straps the same way. Repeat this process for the other foot. Ensure both feet are prepared similarly and all straps are tight. Insert the extension deck into the extension rail. Reinstall the sleeve and locking pin to hold these components together. This lever controls adduction and abduction of the non-operative leg. The slide lever is used to adjust for leg length. The boot lever controls angular position of the non-operative side foot. Wrap the POP and femoral support pads with Coban, web roll, or plastic before the case. Replace each of these pads after 10 cases. IoT offers disposable plastic POP covers to protect both pads. Tape stickers and a drawstring secure the cover in place. Slide the perineal post with femoral support into the adapter rail and tighten the star grip knob. The femoral support acts as a fulcrum to lift the proximal end of the femur during leg extension. To adjust support height, slide it laterally, rotate the support, then slide it back medially to lock it in place. There are 3 height settings available. Height setting is based on surgeon preference. The femoral support can also be removed if needed. After adjusting the femoral support, tighten both wing nuts to secure the POP to the OR table. There are a few threaded holes so the wing nuts can be moved around as needed. Notice the feet are shoulder width apart, the pelvis is straight, and both legs are positioned similarly. This is the goal when positioning the patient. Roll the arch into position, aligned with the operative leg. Ensure all surgical functions are set to 0. Pull the patient down toward the perineal post. This is easiest with multiple staff members. Continue pulling until the patient is tight against the post. Adjust the OLH for proper leg length by sliding it along the OR table side rail. You can also use the slide lever on the ball heel slider to adjust for leg length. Attach the traction boot to the boot holder. This is done by guiding the lower fixing knob into the lower recess, then guiding the upper fixing knob into the upper recess. You will hear it click into place. To remove the boot from the OLH, pull the black pin and pull up on the traction boot. It is best to leave a few inches between the ball heel slider and the stop screw to allow for further adjustment. Tighten both boot and slide levers on the ball heel slider, the adduction lever, and both levers on the extension rail. After tightening the lever, you can change the position of the handle by pulling it out and rotating it as needed. All IoT levers have this functionality. Attach the operative boot to the arch using the knurled nuts. After both boots are attached, adjust arch height. The height setting is shown here in millimeters. Use the height adjustment hand wheel to match the height of the operative and non-operative boots. It is important to adjust height before final positioning of the arch, as the angled design of the height adjustment mechanism causes the C-arch to move more distal when raising the height and causes the C-arch to move more proximal when lowering the height. Make any necessary adjustments on the OLH. Pull back on the arch to further ensure the patient is tight against the post and the pelvis is straight and not tilted in either direction. Ensure the bottom of both traction boots are aligned. This is a good indicator that the pelvis is straight. Using a tape measure, measure the distance between the patient side of the pop pad and the center of the red extension pin. This distance should be 47.25 inches for all patients regardless of leg length. This will align the rotational centers of the hip joint and the C-arch and will ensure no tensile or compressive forces are exerted on the leg during extension or flexion. If the arch is too close to the OR table, additional tension is exerted on the leg during extension or flexion, which could result in greater traction of the leg. If the arch is too far from the OR table, the leg is pressed against the patient during extension or flexion, which could cause knee bending. After positioning at the correct distance, tighten the clamping lever. There is no need to loosen this lever during the procedure, due to the constant traction design of the arch. Secure the arch in place by locking all four casters. The sliding carriage has locking pins on each side to hold it in place. Always firmly hold the black handle before pulling either of these pins. Pull out the pin on the non-operative side and slide the red latch under it to keep this pin disengaged. This will allow operation of the carriage from the operative side using the other pin. Review the pre-op checklist before the case and ensure the following have been done. All surgical functions set to neutral. Feet are properly prepared. Both feet are at the same height. Arch is correct distance from OR table. Patient is properly set. All levers and knobs are tight. Femoral support set to desired height. Casters are locked. The non-operative side pin is disengaged and the operative side pin is engaged.